Well, I think it's less to the UK strain than a whole lot. If you look around Australia with a lot of the hotel quarantine leaks, to infection control procedures that aren't being followed. Everything from governance to training of cleaners, security guards. But particularly if you look at a lot of photos from quarantine hotels, sometimes people aren't wearing masks, but frequently not eye protection, even though when they're in close proximity of people who've got a high risk of infection.
And Peter, we spoke about that last week, the eye protection. And are you telling me that still hasn't changed in hotel quarantine?
Well, I think it may have over the last week, from what I've heard from a number of states, is they're now insisting on wearing a mask or a shield as well, because that stops droplets getting into your eyes as well as being taken up into your nose and mouth. So I think that's essential whenever you're in a high-risk situation. But on top of that, there's the governance and supervision that's a big issue. The latest, there were 3 episodes in Victorian hotels within a week. And a lot of them was due to, I think, not wearing protective equipment when they should have. But, if you look at the issue with the Holiday Inn, it was somebody who was fairly sick, presumably from asthma, probably shouldn't have been in a Medi hotel anyway, should have been in a Medi hotel rather than a quarantine hotel or a health facility, and did say that he used a nebulizer. And nebulizer is a high-risk bit of equipment because it produces very fine particles that travel much further. So these corridors, when you open the door, there's wind and pressure behind you because they're at positive pressure. And so it goes further than a couple of metres, even 4 or 5 metres. And that's why you've got to wear this protection in the corridor. But equally, it also means that, you should actually not have let that happen in the first place. And it appears there was some notice. Now, yes, that could be bad luck, but the fact that there were 3 and 3 within a week is, much more than what other places have. And you've got to look at New South Wales and Queensland and South Australia. They've also had these UK strains, and they haven't had this same sort of leakage issue in the same extent that Victoria has, even though between them they're looking after many more people and quite a large number of UK strain patients that have come back. The UK strain does travel or spread more readily, but maybe 30%, 50%. But for instance, if you've got one UK strain, that's less of a risk than you've got 2 or 3 US strains. But it spreads the same way. So the basic infection control procedures have to be followed. Just make sure you don't, miss it as much. But if you do that, you can contain it. I mean, look at all the other jurisdictions that have had UK strains back and it hasn't broken out and spread widely. There were some fundamental infection control procedures done incorrectly, not only in Victoria, but some of the other places more recently. We need to learn from that, look at it. We need to learn from each other. I mean, Victoria hadn't done any quarantine for quite a while, and they've done a lot less than most other states, or, Queensland, South Australia and New South Wales in particular. I hope we've got a system in place where we're checking each other, we learn from each other's protocols, we pick up the best things, make sure we do that, but we have a cooperative thing rather than reinventing something maybe from scratch.
Well, this is what Christina Keneally said to me just a moment ago. Have a look.
In some ways, it's also about luck. I mean, I sat and lived through...
So Daniel Andrews is just very unlucky?
No,
is that it?
No, the point being that this is a highly unpredictable virus, which is highly contagious. And in some cases, there has been a bit of luck or bad luck in both ways. Let me make this observation, as I was about to before you interrupted me, that I and my husband lived through the red zone Northern Beaches lockdown through Christmas. Had no family with us over Christmas and New Year's, lived in that lockdown for about 4 weeks. And, that was brought on by Gladys Berejiklian, and I don't complain about the fact that she did that. It was the right decision to take. And it's a similar decision to what Dan Andrews is taking here. Now, there's a bit of luck there that the Northern Beaches outbreak did not become worse, did not spread more widely.
So what is Gladys Berejiklian doing, Peter, that we don't know about that Daniel Andrews isn't?
Yeah, I don't think it's just luck. Luck is an element, but it's also good management, not overreacting, but having very good testing, having more limited restrictions, lockdowns. For instance, the Northern Beaches were locked down, but not of the whole city. But it really means the population being on side, which Victoria is, getting tested, but then having good contact traces, quarantining people that need to be quarantined, so you have a much more limited effect. And the reality is, if you look at all over Australia, all the episodes where we've had leaks, including in Victoria last December, we have managed to get on top of this. Now, I think there are some things that happen in hotels, more so in Victoria recently than other places, that need to be fixed so we have less leaks. But equally, we should be confident, hey, we can get on top of this, because every time this has happened, other than Melbourne last winter, where there were a whole lot of factors that have now been fixed, we have got on top of it without lockdowns really making a lot of difference compared to the contact tracing and testing that's been done.
The problem is here, isn't it? If this goes on, compliance. Now, Melburnians, Victorians broadly have been very compliant and patient, you'd have to say. This is the third lockdown, and anecdotally, and that's the only evidence we have at the moment, they're getting frustrated. There was reports of people filling bars on Friday night before the lockdown even began. We had 8,000 or so people at the Australian Open as well. As this goes on, if Victorians are worried about the states going into another lockdown, does it mean that they maybe throw a bit more caution to the wind ahead of that happening because they know their freedoms are going to be taken away?
Well, I think that's a risk. We really have this problem for at least another year and maybe even longer, because this virus isn't going to go away. It's everywhere in the world. And until we get the vast majority of the world vaccinated and levels of virus much, much lower than they are now, this will be a risk for anybody coming into Australia from overseas. So I worry if we actually have rules on that are too strict, more than needed, people won't do the basics. And the basics is if you're sick, keep away from others, keep away from work, keep your physical distancing as much as possible, more when there's, virus circulating. In fact, in New South Wales, having a limit of 5 people to your home instead of many more when there was, virus circulating in Sydney was a very good idea. Keeping the square meterage in bars, etc. down. All of that is essential, along with hand hygiene and masks in appropriate situations. But the problem is, if you start having rules like you've got to wear a mask when you're outdoors all the time, even if you're by yourself, that doesn't make biological sense. So the rules we put in place for people have got to be based on the risk of infection at the time, how much virus is circulating in the community, including, state border closures, etc. Because we have to have people ingrained to know how this virus spreads, which is predominantly by droplets, and what you do to keep that down. People have to have ingrained. So when you have other rules that seem excessive, then you worry that people, particularly young people, are going to say, oh, I've had enough of this. What's the point? It doesn't make any difference.
Yeah, that's right. Just quickly, before Dan Andrews steps up to the microphone, we have one new community transmission today, one in hotel quarantine. He hasn't ruled out extending this 5-day lockdown. What do you think should happen? Is there a case here to extend the 5 days?
Well, I think there only is if you're finding community cases that are unlinked to your cases. I mean, so far that hasn't been the case. And if you look at all these short lockdowns that have been done in Perth, Adelaide, Queensland, it hasn't made any difference to the outcome. They haven't found cases other than would have been or should have been found by their contact tracers. So I think the value of these short lockdowns can be pretty arguable if you have confidence in your contact tracing system and if you have good testing facilities in your state.